Good evening, everyone. This is Francine Crawford, your host. Welcome to Autumn is Here. Today, we're going to speak to Nick Peragine. He is a physical therapist, and he's going to give us some insight on that. So welcome to the show, Nick.
Hi, thanks for having me.
How are you today?
Good.
Good. Can you just give us a little bit of background, tell us a little bit about yourself?
Yeah, so I'm a physical therapist. I work for Professional PT in Soho. I did my undergraduate studies at the University of Scranton, came home to New York, went to Touro University for my graduate studies, and I started working with Professional right when I graduated.
Oh, okay. Physical therapy. Okay, so, my show, Autumn is Here, is about getting people more involved with their parents and kind of like recognizing things and being aware of certain things that they may need to help them as they age and as they grow older. So physical therapy seems to be very, very important because no matter what, every time somebody is with an old person or talk about their parents or something like that, someone they either trip or fall or they have something where they have to go to physical therapy. So do you have clients that are aging or an older client?
So yeah, we do see, a wide range of, ages, demographics, all that. But, as a physical therapist, a big part of what you're doing is, dealing with the elderly and, the ailments that come with aging, just because, well, the longer you're around, the more like you are, something's going to pop up eventually. But also, as you're aging, things start to slow down and whatnot. And, PT can be, a helpful part of the process of getting back from whatever that is.
Okay. So what are one of the things that common that comes with aging that you have to deal with when you're dealing with an older adult?
The number one thing that, most people are going to think about here is just, in general, is arthritis. That can be a daunting term. Everyone, no matter who you are, as if you have walked this earth, you have arthritis. If you take an x-ray of my back, I have arthritis. I'm 28 years old. It's just a natural part of being alive. But it has become this very heavy term that has kind of just become like a non-answer for like, oh, Doc Wiseman, you hear it. Oh, you have arthritis.
Mm-hmm.
So and then guess what? If you go get an x-ray, it's going to show arthritis because everyone has it ever. No one has ever lived and not had some signs of aging in that way. So it can be kind of, people will show up for that first visit for their evaluation with me and they'll have, this x-ray, whatever imaging they have done. And like, they're clutching that to their chest and it's giving them so much anxiety. It's like, Nick, I have this arthritis. It doesn't go away. What's going to happen here? And the reality is that's something that as long as it's handled appropriately and we get you moving and, you take the appropriate steps, what you feel and what is going to be on that x-ray don't have to be the same thing.
Mm-hmm. Okay. So arthritis is arthritis. What is it exactly? Is it inflammation of the bones or is it what is actually happening when you have arthritis? Because
the literal translation of the term is just inflammation of the joint. So what we traditionally think of arthritis is osteoarthritis, which is what, any sensible medical professional is going to tell you is just a natural part of aging. As you age, you've spent your whole life moving, the cartilage within the joint has, starting to wear away a little bit just from friction. And that is what they're going to interpret on an x-ray as arthritis. But there's plenty of people who have what, a doctor is going to call bone on bone. That sounds really intimidating, but that doesn't mean it has to be painful. Doesn't mean it has to be limiting in any way. I'll have people that come in with, an x-ray that looks horrible and they feel fine. And then I have the next person comes in and the x-ray doesn't show a whole lot and they feel the worst. So, all this stuff, it's a piece of the puzzle. It points you in the right direction, but there's a time and a place to do that, and there's a time and place to let go and move forward from it.
Okay. So when you have a client and they're older, how do you assess them? Like, are there different questions that you may ask them if they're older adult, just to make sure they're, have help or something like that?
Yeah. So there's, kind of just like the standard stuff that we have to go through. But then, something I go down is, do you live alone? Are there stairs in your house? If so, is your bedroom on the ground floor, or do you have to go upstairs to get to the bedroom? What about bathrooms? Do you have carpet or do you have tile? All things that might affect your safety within the house and your ability to do what you need to do. And if you have anyone to help with whatever limitation you might have at that moment.
Okay. Okay. So another question is about with dealing with aging is their steadiness. Like as you get older, sometimes your balance is off.
Mm-hmm.
How do you assess that?
Well, with the aging process, one of the first things to go and one of the hardest things to get back is your balance. There's different things that go into that. It's affected by your vision, it's affected by your muscular strength, and it's affected by your brain's ability to respond to changes in position. So that's part of what I need to tease out. If someone comes in and tell me, I'm feeling unsteady on my feet, the first question is, well, how's your vision? When was the last time you went to the eye doctor? Because, rarely, but it's happened. Like that person just needs a pair of glasses and they're going to be fine. And then you gotta go down the road and test the muscle strength, is, a certain part of, the leg, the core, whatever muscle it is there a strength deficit here that could be contributing to your unsteadiness? And then the next step is to actually test their balance. Can you stand on one foot? Can you stand on one foot in front of the other? Can you walk like in line, like a tightrope, like a sobriety test kind of thing? Those are all, tools in our tool belt.
Okay. So as you get older, I know that, when you're younger, you're more active and things like that. But as you get older, how much exercise should you do? Like, should you continue to exercise? I know people are, always conscious of losing weight, but I mean, for muscles and things like that, is it important to continue to have a regular regimen of exercise?
Certainly. And, obviously it has to come with a disclaimer that, every individual is going to have different health problems that, they got to talk to your doctor and sure, all that safe thrown out. But assuming your doctor says, yep, you are healthy to go exercise, it's the easiest thing is to say, okay, let's, meet you where you are. Are you someone who walks regularly? Okay, let's keep walking. Have you not done that ever? Okay, let's maybe go up and down the block one time. That's something simple. But then the same way that the balance is something that goes quickly with the aging process, the other thing is muscle strength. So walking, yeah, there's a certain level of strength that it needs, but at the end of the day, that's more of an endurance activity. That's more cardiovascular. Whereas muscle strength, like picking up heavy weights, that's something that deteriorates more quickly during the aging process. And again, it's more difficult to get it back. So a key part of, elderly or not, anyone's, healthy fitness regimen is, doing some kind of resistance training, whether that's elastic bands, whether that's weights, whatever it is. It's something that should be part of a routine.
Okay. So when they come to physical therapy, it's only for a period of time, correct? And then you give them exercises to do home even after their period of time is over?
Yeah. So the way I practice is on day one, I give people, a set of 4 or 5 exercises that I call their homework. That, you're going to see me once or twice, 3 times a week for a certain period of time. Great. I'm going to put you through the ringer on those days, but the days you're not here, what are you doing? If you're only here once a week, what are we doing all the other hours of the day, all the other days of the week? So I give people things they could do to keep themselves moving. And then when they come to see me, we push a little bit harder. And, during the process, you update that a little bit. And if I've done my job right on the last day, you have, something between your gathered experience and the formal things I've sent you, there should be enough tools in the tool belt to, not have to immediately come back as soon as there's a hiccup.
Okay. Okay. So, is most of your clients or everybody, is it private pay, or are there state pay? Is it allowed to be able to pay for this through the state, Medicare, Medicaid, or something like that?
Yeah. So it's different on a, state by state basis just because of, different regulations and whatnot. But as far as the office I operate out of, we see a little bit of everything. There's a private insurances. We do see Medicare patients, some Medicaid supplement plans and whatnot. It's a pretty even spread, but my office in Soho might have a certain, what we'd expect to be a normal spread. Whereas if you just go across to one of our other offices in Brooklyn, it might be almost entirely Medicare. Another office might be almost entirely workers' comp. So that it's kind of it depends where you are and, what that demographic surrounding the office is.
Okay. Okay. All right. Do you have people there that are like, do you have assistants that work with you, or it's just one-on-one?
Yeah. So the way it normally works, at least for us, is in my office, we don't have any assistants, but if there was to be an assistant in an office, they have to be supervised by a therapist. So I'm allowed to see more than one patient at a time based on the insurance. Some insurances will allow that, some will not. That assistant will then can also see, X number of patients at that time. But I have to be physically present while that's happening. If I step out of the office while I'm on my lunch break, there has to be someone licensed to supervise that individual. And then the tier below that is we'll have the office aides, whereas, that might be a college kid looking to get some experience, build a resume, they'll help, with the non-skilled things like, we got to keep the beds clean for the next patient get in, doing laundry, stuff like that. So you'll see the skilled clinicians like myself or an assistant. And then there's also going to be the office aides running around helping out.
Okay. Do people come there with their caregiver at all at any time? Do they come there with help, or with their children or grandchildren or something like that? Do you see that?
Yeah, I'll see that sometimes. My neighborhood, the office in Soho, there's a lot of the people that have been living there for a long time are right near Little Italy. So there's a lot of like multi-generational homes around there. So, grandma and grandpa are having a hard time. Usually the family is not far away. They will often assist with that. Sometimes the patient will have a home health aide. They're not safe to get there on their own. They'll have, the paid help to help them get there safely. So yeah, we do get a little bit of that.
Okay. 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 Is there anything else that we should know about to help our parents, or to something to watch out for or look for, or something that maybe is common or overlooked that maybe we should be aware of in helping our elder adults?
So the big thing for me is that's kind of my bone to pick with the way just healthcare works in general. But especially for the elderly, I think a lot of good could be done, preventatively as instead of in response. Why are we waiting till someone has a fall to come see me? Why aren't we, looking for signs that something is, not quite right, and, sending them to get whatever help they need, whether it's PT or something else. So like I said earlier, the muscle strength, the balance, these things that tend to deteriorate with age, if you're fortunate enough to have family around to help, be mindful of, maybe grandma hasn't fallen yet, but she stumbled and been able to catch herself. Okay, maybe that's something to deal with now instead of before it goes wrong. What happens when she doesn't catch herself the next time? Around the home, what is, how safe are they there? Is there a lot of clutter blocking walkways? Is there, trip and fall hazards in the home? You know, I mentioned earlier, is it carpet versus something slick like hardwood or tile? And are they wearing appropriate footwear for, I always tell my patients that are a fall risk or fresh out of surgery or something like that is never ever wear socks on the hardwood, because your feet are going to slide right out from under you and you're going to be coming for me for a different problem.
Yeah.
So there's little, nuances that I could spend hours and hours, talking about. But, it's just, if you're fortunate enough to have, family around, there's something being mindful. It's, keep an eye out for the little things that seem benign, but, those things might start to add up.
Okay. Okay. So it's to be proactive to try to prevent some of these things.
Definitely.
Okay.
I would much rather treat someone who's unsteady on their feet before the fall, because, that's going to bring a level of fear. Obviously there might be some pain and injury suffered from the fall that, obviously no one wants to deal with. So as long as it can be considered medically necessary, your doctor can send you, with a prescription for physical therapy, So, and in my opinion, I think preemptive, care for someone who's at risk of a fall is underutilized, because, some people are too proud, or, all these other things, and sometimes all you need is, you come see me once or twice a week for not very long, and you might avoid something that could have been life altering.
Okay. Okay. That's a good point. That's a good point, because we really want people to get more involved with their parents, have an eye on their parents, and, check them out especially if their area is safe and things like that. So, well, thank you. Thank you very much for being interviewed with Artemis here. I thank you for all the information that you've given us, and I'm sure it's going to help some people, and especially physical therapy. It's so interesting how people, as you get older, so many people, more people need it, so we want to get this message out there. So thank you so much. We appreciate it. And I thank you for taking the time to be interviewed for Artemis here. Okay.
Thanks for having me. It's my pleasure.
All right. Thanks.